Looking forward to chatting to Marilyn today. Maddy Locke. She taught me Alexander technique in order for me to be able to manage chronic pain a lot easier. And Alexander technique, it's a really special physiotherapy. It has a lot to do with kindness, being good to yourself, listening to your body, mind-body connection. So I thought this is really good. This is a good one to bring to everybody. So I hope you enjoy it.
Who's that?
Perfect. Can you hear me?
Yes, I can.
How are you?
Oh, look, I'm good, yeah. And I have to say, Soula, contacting you and you responding the way you has, look, you've really, you've got me going.
Oh, have I? I hope in a good way.
Well, at the moment I'm thinking, oh my God, can I do this anymore? Everyone has their own concept of retirement, but for me, without being able to give, it's not very meaningful to me. So, and each to his own, but, I'm just not into bridge or bowls or cruises or... Well, I'm coming back to wanting to actually write a book, and it's just an audio book and an ebook on walking when it hurts. I have had significant increase in pain. In the last 5 years, I have walked 2 more Caminos, so almost 3, I think.
Oh, wow.
I did an 800 kilometres, then a 400. And then the Portuguese one was 240, and just continually came across even young people really battling with pain on walking. Wow. I'd video them walking and then, give them a few tips. And
I was going to say, if you stopped to help everyone, Marilyn, you'd never make it to the end.
But it was just a wonderful experience. I just adored it.
But let's start at the beginning.
Yes.
So Alexander technique, I came to see you in East Melbourne. I was in Collingwood, you were in East Melbourne. I actually don't know how I found you. I think I Googled you and I found that it was looking for a physiotherapist, obviously in walking distance, but I think I found you that way because I remember it wasn't my doctor, because I went back and said, I've found this most amazing physio. And yeah, and she's really helping me, and she quickly wrote it in her book so she could have the details for many of her other patients. But the Alexander technique, that's your specialty. But do you want to just tell people briefly what Alexander technique actually is?
I think it might seem strange, but it's probably quite a very hard question to answer for most Alexander teachers.
Okay.
For myself, it was an exploration, a learning, a journey of discovery, and a return to a sense of wonder about how I am and why I, move and do things in a certain way. And really, to learn, one has to be childlike, not presume that one really knows anything, to be an open book, which makes us very vulnerable. So a journey of discovery into your own body's unique responses and habits of tension.
Beautiful, yeah.
And the Alexander technique increases your awareness of how your body responds to thoughts and feelings. Yeah. Feelings such as pain. So the Alexander teacher and the student work together to increase our understanding together. We're on a discovery together. We both become our scientists, which if you read the very small book, the first book that Alexander wrote was called The Use of the Self. And it explains the journey that he had to go on to discover these things.
And just Alexander's, just in there, he's Australian, he's from Tasmania, isn't he?
Oh no, Wynyard, sorry. And he was, in the year 2000, he was put up as one of the great one of the great achievers for Australia.
Yeah.
And they had to quickly do some sort of statue, etc., on this peak. But, because, no one sort of, most Aussies don't have a clue who Alexander is. But if you mention it in the UK, most people know what it is. Often I say, "Oh, you from the UK? Oh, well, I can talk to you about Alexander because you've got some idea of what it's like."
Yeah.
Whereas many Aussies would just say, "I've never heard of it. I don't know what it is. Oh, is that thing that's about posture?"
Oh, right.
Which is fine,
Yeah.
that's okay. But it's so interesting when they say that, because then the fact that you're a teacher, they start to do something, to stand up straight, thinking that's what she means. Increasing our understanding of the impact of our thoughts on our sensations, on our ability to move with ease or without unnecessary tension. Alexander, when people ring up and say, "I want to learn the Alexander technique," they've already traveled a long way in their own self-discovery to decide that this is what they'd like to do. And not everyone, everyone at their own pace, in their own time. One always has to evaluate when a person comes in, and working with them over a couple of sessions to see, what approach is going to work for them, what is useful right now that they can take home with them and into their lives. It might be something very simple, like looking at positions of comfort and just tweaking them so that they can find some release and some relief. So I went and worked in a pain management group, and it was interesting, the concept of meditation, that was still being something that you do when you're sitting, which I've been a meditator for a long time, and I've learned that it's okay to meditate lying on your side if that's the place that you're most comfortable. And if we ask someone to meditate in a place where it's uncomfortable, it's really very hard for them, because they're not going to be able to sustain a relaxed breath, and in the end the meditation is all about the breath.
Yeah, and they're sit, they tell me, sit to meditate. Well, sitting for me is the worst trigger of all, sit. And I used to sit cross-legged. I would always, wherever we were, I'd go to the floor and I'd sit cross-legged. That would be me on the ground, whether it was a beautiful frock, whatever it was. I was so happy to just kick off my shoes and cross my legs and sit on the ground. I loved it. Always loved sitting on the ground. Well, I couldn't do it, and it puts the pressure on, because it's not meant to be pressure. Obviously, it's meant to be relieving and your place of escape and calm, and if you can't, it is a pressure. Yeah, it took me a long time to learn. So just go and sit on the toilet, because that's comfortable.
Yes. That's right. I remember that. Yeah. This is a platform for chronic pain, or what I would like to often call persistent discomfort.
Well, I like that.
I'm mindful that people with chronic pain get a lot of flack and also self-criticism that they shouldn't be having this pain. If they did all the things that everybody said that you should do, you shouldn't have it, so you're some sort of failure.
It's so true. Oh, Maddy, that is so true. You're always kicking yourself. Oh, it's my brain. Oh, it's because I didn't move enough after I hurt myself. Oh, it's because of this. Oh, it's because of that. Yeah.
I shouldn't have it.
Yeah. I shouldn't.
The medical model, and even now with what they're doing recently with medications again, reducing them again, where people have been able to say take tramadol every 2 or 3 days and being able to still work, that's blocked. There's some tragic stories about that. I'm not saying that narcotic drugs are the ideal, But I think, you know, when we look at somebody with rheumatoid arthritis, we would never dream of taking them off the prednisolone or the anti-inflammatories, because that's what will take away their independence. They won't be able to get up in the morning.
Yeah,
And
it's just gone too far, hasn't it? It's really
I
gone
think there
too
needs to be an understanding of working, as you've quoted me, working with the pain to see how we can get around it. The Alexander technique is about stopping.
Yes, it so is about stopping. So is about stopping. Yeah, about just reflection, a lot of reflection.
We're not very good at stopping.
No.
So what Alexander provides for us is an alternative. And there was this talking, I think, about in terms of getting more exercise and being more healthy. Don't stop it, just swap it.
Ah, I like that. Yeah,
and I think that's a good one for Alexander, because what it gives you are positive strategies called directions. So while you think, I'm going to tense up when I reach for this coffee cup, you know, I know it's going to be sore, but I've put it over too far and there's no way I'm going to have to reach out. So yes, we need a moment of stopping, but then we need to replace it with, okay, what are the possibilities here for me now? What if I allow my arm to gently lengthen from my torso and just see what happens, see if it can arrive at the cup?
Yeah.
You know.
Yeah.
So it's not negating our pain. And Eckhart Tolle says resistance is futile.
Yeah, what it does. I mean, just it feels like it with Alexander technique, for me anyway, it felt like the doors remain open. So it might be hard to get sort of in the room, or it might be difficult to be back where you may have been, but it doesn't shut the door. Everything is so brutal and harsh when you start to learn about, you know, living in pain and treatments, and it's all, don't do that, do this. But it's light, and there is room for conversation and consideration and change and movement and doing things differently, as you say. You don't shut the door. You shut that door and it feels really harsh, because if you close it, you cannot open it again. Then it's really hard to get past that again. Whereas if you're just in that space again and you want to get into those rooms of life where you were again, if you just leave the door ajar a little bit, you know, you're most likely going to get back there. Whereas if it's shut, you're not going to be able to do it. That's sort of how it feels for me.
That's a great analogy, I think, because I guess I was thinking, well, finding a way.
Finding a way, yeah.
I can't go through the door that way anymore, but is there a way that I can start? And perhaps I'm not going to get as far as I want to get through that door straight away. But what if I start to just tweak it and just see whether I can get a little bit close?
Yeah. We hear about people, you know, needing to be kinder to themselves in normal, healthy circumstances. And our lives are really busy now. There's the added stress of the pandemic. And, you know, if you've also managing chronic pain, I mean, how can we possibly find that light in the chaos, the way to undo our knotty lifestyle and be kind? And I know that Alexander technique, that ethos and the philosophy of it, and the approach of life with Alexander technique would have a lot to offer, how we can unknot our lifestyle and be kinder.
I think the word knotting is really interesting, because it you know, that's very relevant to our tension habits, which is, you know, usually increasing our muscle tension.
Yes.
As if, and they develop knots, and you'll go to a remedial therapist and say, oh, you know, oh gosh, you know, it's so knotty.
Yeah.
and the belief that with Alexander, which is increasingly being further validated by scientific research, which Alexander didn't want to in his time because he was in the early 1900s, and he said no, because you won't have the understanding. You scientists with your reductionist model will not be able to understand this holistic approach. But we're moving on from that, and some of the research done about the so-called core strength, etc. There's been some comments with some of the research articles that are actually saying, well, in actual fact, engaging the core is more about how we are thinking.
It's an awareness.
Rather than us trying to do something. I think the kindness is saying even that it's okay for me to just stop.
Yeah.
And not push through.
Yeah.
And just come back and just check in and say, okay, well, what's going on for me? What's trying to get ready, to boom and bust with my pain, and how can I change my approach to that? And I suppose with kindness, in terms of a very practical way, I see us just coming back to our breath.
Yes.
Just the breath. It has such a calming and also gives us clarity in that situation. If we can come back, because it brings us back to the moment. And often we preempt when we go to do something that it is going to hurt.
Yes.
So, okay, we have that fear that it is going to hurt, and it may hurt. So what is the best way for us to approach this? Because I guess once we understand that our increased muscle tension involves extra effort, which in most cases will make our pain worse. I'm not saying it'll take it away. Even pain management programs do not promise to eliminate pain. Some of their best results will eliminate the pain by 30%. And what I say to people is, if you can get a good night's sleep, and you can have part of your day where you've got 30% less pain, you are winning.
Oh yeah, absolutely.
You're ahead.
Absolutely.
You're ahead.
Yeah, just back on that, the breath. I think it's really, that's a sign of the times, isn't it? To sort of say, just a minute, allow yourself to breathe, allow yourself to take a breath. Like, that's actually really, that isn't that telling, when you just need to tell yourself, need to make yourself aware to just stop for a second and just take a breather and tell yourself that everything's going to be okay, or just to have to do that isn't, we're way too strung up. That's crazy if you have to do that, almost, isn't it? A little bit.
Yeah, and I think the problem too is it's often so simple. So people think, oh, well, I've done that.
That's not going to work.
I thought you were going to give me a new medication or a new exercise, or something like that. And the meditation, the breathing can lead you into a type of meditation, but it's not sort of zoning yourself out of the reality and the present. It's actually bringing yourself into each moment. And you can do a simple practice, just say over 10 or 20 seconds. And then if you're finding that's beneficial, you can do that fairly often. You might choose to do it every couple of hours, or at meal breaks or something like that. It doesn't have to be something where you have to sit down in a calm environment and have no noise. And the concept for many people, to try and put aside time to meditate just doesn't work. No. A lot of people, it doesn't work. No. But just stopping every now and then through the day and just checking or doing a body mapping. What's going on for my back at the moment? How are my muscles going there? Is there something that I can change? What happens if I just come back to the breath and let myself be breathed for a moment? Can I sense those muscles instead of tightening and knotting up? Can they lengthen and release a little bit more?
We check into everybody else, don't we? Like, we sort of sit there and go, oh, now, how's mum? How's dad? How's so-and-so? So we check into everybody else. We don't seem to check into ourselves.
Yeah. As you know, I mean, it's a learning process. It's the pain, chronic pain introduces us to the university of life.
Huge learning process. It's certainly a huge learning process.
And the ways we learn will vary for each of us. So, learning can be visual. It can be a word that we hear. It can be a sensing. It can be all those three things. So in the Alexander technique, we will tend to say, I'm not exactly sure what's going to work best for you. These are the suggestions I have got. You don't have to remember everything that I am saying or doing, but come back to the feeling, your feeling, what is true for you. That is what you will find that you will remember. And it's just, as you said, opening the door for you. What is going to open the door for you to consider? There's some possibilities here of the way I approach this ongoing pain.
I have choice.
Yeah.
I have a way, I have options. I know, and it's not what we're used to, as you say. People are used to receiving something. Here it is. Here is what you need. Take it, or pat yourself, touch yourself, or do use it. But it's never really just something that you have to imagine, envisage, adopt, alter. It's almost, these are sort of the invisible things. This is why I guess it goes hand in hand with chronic pain. It's invisible. You're sort of battling all these invisible things. Even this, that's not how treatment is. It's more physical and tactile, and you go to the doctor and you receive something and off you go. So it makes sort of sense that people just say, oh, well, this isn't going to work for me, and they try it for a second, and no, they can't really do it properly, or can't approach it properly, or whatever, and it doesn't work, and so they give up. But imagine if society did really value, and you do have those cultures that value, where you've seen babies growing up with meditation all around them, and the benefits, you see the benefits for those people.
Well, I must say that Alexander really, with his inquiry and his amazing study of himself, and then he developed a program to educate others to become teachers like him. He truly felt that what really needed to happen was that the technique needed to start in the primary schools.
Of course.
And there are some schools set up in the USA and in England where Alexander teachers as parents have got together and set up schools.
Wow.
Where the children start each morning doing a check-in and even do some gentle hands-on work with each other.
That's so great.
The Alexander technique has generally formally been taught as a one-on-one with hands-on. But obviously with COVID, and also has been developing for some time, Zoom meetings of learning aspects. I'm still a very tactile person, so I always love to meet somebody with my hands to get a sensing. And what happens with the teacher has to train in the first year to simply observe themselves. They're not allowed to put their hands on anybody.
Wow.
So as a physio, I had to unlearn a whole lot of stuff because I always had an agenda when I put my hands on somebody.
Yeah.
Then the second year, you learn to look after yourself and continually use your directions as you put your hands on the student. So we are teaching the student. And in the third year, you learn to work with people coming in off the street, etc. And still, but it's always, unless you are directing well for the day, you really should avoid putting your hands on someone because you're going to transmit your habits of tension to them rather than it felt like paying my clients, because when I put my hands on them and they've responded to my hands, I've then got this amazing release in my lower back. Sometimes I say, well, who's helping who here? Because it's such a connection.
Yeah, it sure is. I mean, before when you spoke about Zoom, I couldn't imagine seeing you over Zoom. I couldn't imagine it. I mean, it was a small room. It was fantastic and intimate. We had the reformer. Everything was there, but it was just the carpet, often getting on the ground on it before as well. It's something that we approach together, definitely.
Even the medical research in sports medicine, because I did my postgrad in sports medicine, has really confirmed that while exercises can be useful, it has to then, the person has to relearn how to apply, even if they get stronger muscles, how to apply that in the actual activity that they want to perform. So many people came to me who were dancers and elite athletes who had had their surgery, who'd had very good rehabilitation, but they couldn't integrate that area of injury and pain previously back into the whole. So it was such a privilege to be able to work with them, to help them understand that we don't move like exercise. We're not robots.
No.
We're an integrated whole, and we have some, well, I call it magic, but it's not really magic, but it's the spirals, the amazing spirals that we have that give us power, skillful, coordinated movement. And then the strength is secondary. It comes with attempting to do the things that we're having difficulty doing. To back up, I'd just love to quickly tell you a story that I had when I did work with a pain management company, where, the physios would actually work with a psychologist, and for the initial session with somebody who was going to come along to it, it was spread over 3 months. We would need to look at their goals. What did they want to achieve? And there was this young girl who was a marathon runner, and she'd had dreadful back pain, so she'd had back surgery. Now, she still had some back pain and she couldn't run. And we always looked at your goals in terms of your social goals, your work goals, and your recreational goals. And she said, well, I want to be able to run. And we said, well, what do you mean by that? And she said, oh, if I could run 30 minutes 3 or 4 times, or perhaps 5 times a week in the mornings. So, and this is amazing, and this is why it's often really wonderful to work with these people, because they actually do know their bodies quite well. She said, I'm going to start at 5 minutes. So her starting point was 5 minutes, and within 3 months she was up to half an hour, so 3 to 4 times a week.
Wow.
And of course, if to be more creative too, she added, the other days I walked.
Oh, wow.
It's not an all or nothing thing. It's just an ongoing tweaking.
Yeah.
And it's a life lesson. We have to do that in life anyway. We have been talking about the concept or the word of aging well. And that doesn't work for many people who have ongoing and increasing restricting degenerative disease. And they've come up with the word adaptive. Because it's a constant tweaking and adjusting.
Yes.
Okay, no, we can't do it that way. So how else? It's not all or nothing. We can do a little bit of running.
Yeah,
We
and
might be able to provide a little bit of running with walking.
And it's adaptive. It's also becoming, I mean, I'm 51 now. I think you're learning, like the value in people who...
You don't look 51, you look the same.
Come a bit closer. So adapting and learning, and like how wonderful, how wonderful but again, it's sort of something we don't value. We just, they're old, you're aging, you're losing your value. It's not, you're actually gaining. What do you mean? You're more valuable. You speak to people who have lived, as you say, you referred to the people that you met in Newcastle, and that reminded me of the people that I've met here in Queenscliff as a very much older demographic. My goodness, their lives, you could write a book. I think you can knock on each door and speak to somebody and write a book about their lives. It's just extraordinary. It's so lovely to meet them and sit down and just hear their stories. We did talk, I remember you telling me about, I think when we were on the floor, balancing a teacup on my back.
Oh.
Trying to lift one hand up. And you told me about the singer. You were training a singer to sort of...
Oh, yes.
I remember that was so interesting. So interesting.
Yes. We had an amazing music teacher. He was a conductor actually as well from New York, that visited our Alexander School at one time. And a guy came in who played the clarinet, and he was getting neck pain and shoulder pain, and it was fascinating how he started playing the clarinet, and this amazing teacher got down on all fours and started putting his hands on this guy's heels and into the inner arch. And as he was still playing the tune, the whole quality of the music changed.
Wow.
So I think this is the other thing I wanted to actually share with you about chronic pain, is that the reason Alexander decided to go through this discovery was he was an orator of Shakespeare in the early 1900s, and he lost his voice when he used to get up on stage. So he went to all the expert throat people in Melbourne, and no one could find anything wrong. So he went back to his farm in Wynyard and decided, okay, it's obviously something I'm doing that's causing this. And he had 7 years of study. He had mirrors all around him observing what was going on when he orated. And that's how he discovered initially, oh, it's the breath. It's the breath that's affecting it. Oh, but hold on, the breath is affected by what I'm doing with how I'm holding my hands. Oh, and that's affected by, oh my goodness, I'm holding my hips, I'm squeezing my butt. Do I really need to squeeze my buttocks when I'm orating? So, he did this whole sort of body mapping thing, and he observed animals, and he said, my goodness, they move with ease and grace. And he looked at children up to the age of about 4, and their movement is so loose and lithe and
their head
and effortless.
Yeah.
Yes, the primary control, of course, is so. the thing that really taught him what he needed to change was what was happening with his voice. And while none of us want to ever experience chronic pain and wouldn't wish it on anybody else, it is a teacher in the sense that, you know, if we're doing something and the pain is increasing and we tweak that a little bit and say, oh my gosh, I've been able to reduce that by 20, 30%. You know, it's leading the way for us.
Yeah,
it's a very effective biofeedback system.
Yeah. Yes. Well, that sort of leads into this next question I had, when I remember you saying to me, Soula, you will learn to work with this pain. And at the time I just thought, I mean, the volume in my body was so cranked up that, you know, I really did feel like I had my fingers stuck in a PowerPoint all day. And I just thought, oh no, there's no way I'm going to learn to live with this, you know. And so I felt, you know, I remember everyone says the body's trying to tell you something, there's a message, and I fought that message. I thought, no, look, I know where my body was before and I just want to get there. The accident wasn't serious. I recognize that that's what my body and my brain, that's where it wants to be. But there is this call to stop. You have to stop, you know, and the body is calling for that. Slow down, adopt, adapt. What do you have any advice for people to help them stop? I mean, we're talking about maybe not stopping now, changing, maybe we're scaling back, but how do we, you know, you're in the middle of your working week, you know, and the bills are in, you know, and everything's piling up. Where do you start? Well,
what we really want to stop are the negative things that are going on for us that, you know, magnify our pain or increase our anxiety. So it's interesting, the word stop, isn't it? What stop and do nothing, stop and not think, stop and whatever. And this is in the Alexander world, it's stop, look at your habit. And with the Alexander training, you realize as you've mentioned, you have choice.
Yeah.
You can now stop your habit of tension and even resentment, anger, all those things that come. I just want to get this done. And use your directions.
Yeah.
So you stop initially, but then you replace the habitual patterns with something that is beneficial for you, and that will actually take you into that new pathway, because you're just really wanting to still go down the old pathway, aren't you?
Yeah,
you know?
well, that's it. Until I realized, you know, that life as I knew it, I was not going to be able to go back to that life. And it's interesting because the minute you pivot, and it's terrifying facing this open canvas, this blank world that you have to rebuild. That's terrifying. I did have, you know, sort of the physio, the things I needed to help me were really starting to fall into place after that diagnosis. And so then you start going forward and you realize you are rebuilding, and you're heading towards where you were. It's different, but you are still rebuilding and heading towards that life. But you do need to just, well, I had to stop. What I know now, I wish I knew it then. I would have just really early on been able to nip it in the bud. I wouldn't have had to rebuild my whole life. I would have just adopted, amended. But it was interesting. When I stopped and turned around, I started to rebuild my life, and I've come to a fantastic life. It's obviously bittersweet. You know, you'll always long for your old self. Of course you will. You're pain-free. You're free little bird. But if you can't have that, my goodness, I've come to a life that is so similar to what the other one was. Yes, it's hard, but I hope that others can learn. This is the whole purpose of the advocacy, is for people at a 6-month mark where they sort of do say, look, this is becoming chronic. There's something going on here now. You're heading into into the woods, into the forest here. You've really got to, if at that point we can make people understand, okay, please just put some serious time aside and change. You've got to change a few things here and prevent them from ending up in the hole. That would be really great, would be really good.
I think it's an ongoing negotiation.
Yeah, I like the way you're saying that. It is an ongoing, I like that.
With that inner voice, you know, if only, or
Yeah.
and I mean, I honestly believe that when I damaged the nerves in my arm with physio in, you know, a long time ago now, and I just had to go down a totally different path. I really actually don't have any regrets. In fact, I have colleagues who are still working the same way they were working 30 years ago, and obviously helping people and enjoying themselves, but enjoying their work. But I just feel so much richer for having to go in a different direction.
Yeah.
And I can see how it encompasses so many other areas. My sister has early Alzheimer's, and the study of, you know, of dementia, and it's so interesting that the most significant thing any of us can do to keep our brain health, brain reserve, is to get out of our comfort zones. The more we activate the brain, even though as we get older, we may get those tangles and things go on, we will be less symptomatic and more cognitive for much longer. It's called brain reserve. We create brain reserve.
Right.
So we are fighting with chronic pain against the fact that life should be comfortable. And I'm so sick of it being uncomfortable.
Ooh, I like
and that's
that.
really hard for us to face. But in actual fact, as you get older, that is life.
Yeah.
That's what life brings up to you. And so, you know, they suggest, well, you know, if you love if you love learning about travel, etc., but you've been mainly doing that, go and learn a language.
Yeah, wow. Oh, look, I love that. I can relate to all of this because we're two aging parents on either side. Mum's just had a stroke, or a year ago. My mother-in-law's in an aged care facility, and sometimes, I mean, my mum is up and about a little bit, albeit she's very restricted and it's difficult. But there'll be times where she says, "Well, no, I still want to go and do my shopping. I don't want you to order it online." And I don't want your dad to sort of choose the almonds. I want to choose the almonds. And it's like, well, Mum, have you not been watching? Not that I want to ever compare her to me, but and I say to Theo, this is what I'm not complaining about, Mum. I'm just saying, then Theo and I turn around and go, we've had some pretty good training for when we get to age. You know, we're already thinking, well, we are going to be in an aged care facility somewhere, and we're not going to be able to have, you know, the chocolate that we want maybe or whatever. But I just think, wow, we have had some serious training
in acceptance, but you know, I don't want to say this glibly. You know, it's hard.
It is,
and the worst thing we can do is compare our lives to anyone else's.
Yeah, we do need to remain grateful though too, don't we, Maddy? Because we have so much. I mean, that I always just go, hang on a minute, let me just line it all up again. Here's this. You know, look at them as little chess pieces, and here's one that's coming to the side, the front, and saying, you still can't drive, you still can't drive, you still can't, you know, you still can't. Okay, let's push you to the back, and let's bring Theo to the front and bring your beautiful new babies that your nieces have had, like that. And you're creative. You can pick up a pencil and just draw. You can just bring this. Look, you live in a beautiful place. It might not be where you were, where you love, where you know all that. Yes, but and let's just push that other awful guy back and put things into perspective. We have to, because we do have a lot. We live, you know, despite the political or whatever else is going on, even a pandemic, I feel very fortunate. And I keep pointing that to me. I keep pointing it out. I still feel very fortunate.
Gratitude is very helpful, but I do understand, you know, probably earlier in the phase when people have chronic pain and, you know, they would love to be able to still do things for their family or what have you.
Oh yeah, I wasn't grateful then.
No.
In my second and third and fourth year, I was ready to leave Earth. I couldn't manage anymore.
It's a wonderful place to come to, isn't it?
Mm. Oh,
I guess what you're saying is, on reflecting, and I guess that's what I'm saying, is that I believe I have a richer life for the experience, but I would never wish anyone to have, and that's what I'm saying with a biofeedback system. You would never want anyone to have pain, just to learn these lessons. But the fact that they have got it, we can use it to some advantage, to be of benefit to ourselves and to others. You know, you mentioned the light. I found the light, particularly when I walked into aged care, because so many of them were waiting for me. They're all in chronic pain. And the minute I would walk in, it just sort of started to spontaneously happen. This huge smile would come on my face. And then I would go and chat and say, hi, good morning, how did you sleep? Da, 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 da. And it would just set me up to be happy for no reason, no necessary reason, just to be happy. Because to me, that was probably the best thing I could give them was a smile. You know, that there is still happiness in the world. And we, you know, along with the breath, and we don't want to have to force a smile. But if we wonder how we can still be of benefit with others, and we can't work, you know, we can't do the things that we felt would show that we truly care. If we can put a smile on our face just for a very small time in the day, you know, around our families, it can have a wonderful effect. A smile also relaxes our eyes. So if you're using the computer and you're feeling strain on your eyes, smile and the eyes will relax. It's a beautiful.
Just on that, this is perfect lead into the things that you taught me specifically. We'll get, because people are probably thinking, what, you know, I'm still not quite getting understanding totally what I might have learned from you, but just the real physical day-to-day armor that I have today. I mean, your words are so stayed with me. They're in my head every day. And so that's when I stand at my desk, which, you know, I'll be sort of turning the camera on and off when I stand. I've got a great chair here. When I hold and lift a glass of water, you know, I mean, I used to hold like, you know, and you just taught me to, you know, really just lightly, just all that approach, getting in and out of the car, if I have to climb stairs. And just as what you just said now, you know, when I'm tense, to look in the mirror and just say, hello, that change. And also to listen to Bach's music.
I loved you mentioning that. Yes.
Getting in and out of a seat, now trying to help my mum after she's had a stroke. I mean, your guidance really is ever present. It is certainly a kinder approach, a kinder daily approach, softer, lighter, hard. Everything else is hard. I feel like what's happened now is that I've softened, like after learning and working together, there's a softening, and that's so crucial to chronic pain. We looked for those knotty bits, we honed in on them, and then we softened them, we made them more malleable, and so we could work with them, but everything just feels softened, lighter.
And I'd like to add to that, I want you to soften and release into the up. I want you to soften and release into your effortless power that is there.
No. Keep elaborating.
Because some people may soften into collapse.
Right.
And for you, and you've had lessons, you understand how that softening allowed you to be light and upright and open in your joints and available. But for some people, when I look at the way they're using, because Alexander, it's about how we use ourselves, the use of the self, I have to be careful with my language. So for every thought, there's a muscle response. And it's using the words, the kind words, that are going to help them to come to a place of entertaining the possibility that movement can be effortless and powerful without trying so hard. You know, that it can do itself. Standing can do itself. Sitting can do itself. And to do that, we don't collapse. We soften and we release it, so that the upward dynamic can be the powerful self that it is. You know, managing that 5 kilogram head of superior intelligence. I often say to people, remember, you're developing superior intelligence. You know, to work with you and for you. And it takes you along. It takes you along the path. You don't have to drag it along. Let it do what it's designed to do so well. The head sit comfortably on top of the spine, you know, and realizing you're three-dimensional, which is always hard if you're doing a lot of work in front of a computer, because it keeps pulling you into the linear. So that we have a back, we have a front. You know, and that's where our breath, come back to our breath, is three-dimensional. It's not something that goes up and down. It goes up and down, it goes out to the sides, it goes from the forward to the back. So that's our amazing tube of ever changing. The breath is never the same in each second. It's changing. And so sitting, standing and being is forever changing. It's an ongoing negotiation with gravity. And gravity then can work for us and allow us to be the best we can be, our potential. Our potential. And so if we make comparisons, but I was better than this before, we do harm to ourselves. It's not kind. But the sense of wonder, what is possible here now, is extraordinary. And I just love working with people to just that and that's how we really need to look at each person, rather than being judgmental and blaming. Is what is the potential in this person? We know it's just unlimited. Unlimited.
Well, don't they say, like, with children, you know, always stay a child, make sure you've still got that child in you. And I think that relates, that's the sense of wonder, isn't it? That is.
Exactly.
Yeah, it is definitely.
And being okay about not knowing.
Yeah.
Not knowing, because that always opens us up to learning and responding in the moment, you know, and realizing, of course, I don't know whether I said to you this, but that really, that's all we have. We only have the now. We don't have the past. We don't have the future. We only have the now. And that's what, and some of our pain can be aggravated by, you know, even thinking, I've got this long car drive to go in. And already, you know, you're starting to, the muscles are starting. I often used to say to people, before you get up in the morning, I want you to notice what your pain levels are like. Or notice whether there's any muscle tension. And then I want you to start to think about your activities for the day. And then I want you to notice what's going on with your muscles.
Yes.
Because what happens is, once we start to think about those activities, we haven't even got out of bed and we're already tensing up to get ready for it.
Yeah.
Which is what Alexander calls end game, not end gaming, end gaining.
We could ramble on for age. I could talk to you forever, and I can just feel my body. I'm slowly floating through the space right now, which is exactly what used to happen when I used to come and see you. Suddenly, everything's sort of open and spaced out. It's really, really lovely. But there will be a lot of people watching this who will think, I'm not going to be able to get there.
I guess I prefer to call it "come and work with me." Let's go on a discovery tour.
Empowering.
See what we can find. There can be a lot of anger too related with pain. And or why did I do that stupid thing, or why was that like it was, or it is a mental process as well. But I guess the thing that I'm very wary of is suggesting to people, oh, it's all in your head, because look, your head starts from the top of your skull and finishes at your fingers and toes. You're not separate. Your mind is your whole. And it's always interesting when people will come back after a few lessons and they'll walk and they'll say, you never guess what I've done. Oh, I won't say anything. And they said, I've quit my job. Oh. And they said, I just realized that the way we are working is the way I want to be. And my job doesn't allow me to, and this is not in every case. Many people can go back and be better in their work. But if you're in a culture where you're constantly enduring stress, it's very hard. If you are kind to your body and you allow looseness and vulnerability and openness and availability, then your mind that thinks about musts and do's and effortful and stuff, the two can't no longer survive together.
Someone's got to go.
Something's got to go.
Yeah.
And that was quite profound for me. And I'm not suggesting everyone will do that, because I think it's these tiny subtle shifts that can work even after you say you come for 10 lessons or something. We've started something that will go on for the rest of your life. Fascinating now that they're researching dementia to find that the best thing we can do is to challenge ourselves to be uncomfortable. Oh, I don't want to try that new recipe. I know all these new things, but then, okay, might learn something new about that, which would help me with the stuff. It's just being more open-minded.
Sounds like I'm never going to get dementia then. That's great. You won't either.
What I'm saying is you do. By the time you're 90, 95, if we're going to have it, we're probably going to have it.
Yeah.
But, it can mean the difference between 5 to 10 years of being a lot more purposeful and meaningful and happier in your life.
Yeah.
And that's the best that research has shown, irrespective of diets or whatever.
Yeah.
The problem is that as we become adults, we decide we're going to do what's comfortable. When we're studying at school, we're constantly being taken out of our comfort zone.
Yes.
When we become adults, right, I'm going to keep doing what I know.
Yes.
Because that's comfortable for me. And that is a problem for our brains.
Makes sense. Use it or lose it. I really like that mentality. But
thank you so much for the opportunity. And anyone who's listening there, I really wish you well in your future journey with ongoing pain. It's a big challenge. So please be kind to yourself. And yes, you can look up the website. You could even try some Zoom, Alexander, initially, just to get the feel of it. You can go into a discussion. There's really a lot online. And there are Alexander teachers around Australia.
Are you available? Are you working, Maddy? You working in?
Oh, yes. I'm mostly doing home visits at the moment, but I'll be looking at a base again at some stage in the near future. Yeah.
Thank you so much. Thank you for being with me every day. as well. You've truly armed me.
Oh, I can't thank you enough. Soula, the giving is a two-way thing.
Bye.